Big number we're keeping an eye on. Big number is a small number, 4.72%, but that is a really big deal. That is the average rate of a 30-year mortgage. It's been rising over the past 5 weeks, and now it's landed at the highest mark we have seen in some 3 years. Keep an eye on that. Of course, I want to turn now to you, Dr. Sutton. Look, after COVID, anytime we sneeze, we have a little tickle in the throat, anything, we think COVID often first. But right now, it's allergy season. We need to keep in mind some of these symptoms, but also some things we can do to maybe have not such a harsh season.
Absolutely, and a birdie tells me backstage that you and I share really bad allergies.
Bad allergy issues, yes.
It is beginning of that season. It starts later this month, and it officially starts later this month, and it goes to mid-May. And we calculate this based off of a couple of different reasons. Number one, many people are coming into the emergency room often during this time with allergy-like symptoms, and then the increased sales of over-the-counter medications to treat allergies we started to see already. There are some important things to know that we threw up on the screen. The first is know your trigger. The most common right now is tree allergies, but it can also include dust, mold, and pets, of course. And then the symptoms are something that we call in medicine rhinoconjunctivitis. It is a long word for a stuffy nose, watery eyes, and a dry cough. And the best way to really figure out whether or not you're going to have allergies that day is just simply check the reports, similar to the ways that we check weather reports. And I know that many people are going to say there's so many things to check in the morning. I have to check the weather, I have to check the pollen, I have to check COVID-19 rates, but all of these things help you risk stratify. And then also check up on those over-the-counter medications. But if you're going to take any, make sure that you check with your provider to avoid any medication interactions. And while you're there, double check medications that you're on, because certain medications like birth control and medications for blood pressure can cause something called post-nasal drip, which can give that irritation in the back of the throat and that sensation that you need to cough. So those are some of the things that you should be aware of.
Okay, but watch pollen reports. How does a pollen report change my behavior? What would I do differently if I'm already on some allergy medication?
Great point. So sometimes people just want to know if they're going to have a day that is highly triggering. Okay. And sometimes prophylactically or before you develop symptoms, you can grab a Claritin or a Zyrtec or other antihistamines to help you decrease your risk of symptoms.
Gotcha. Dr. Sutton, always good to have you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.